I've been working on this for a long time, for 20 years, on climate change issues. I believe that climate change poses one of the most challenging crises in public health because it can affect us through so many different ways. Direct effects from heat waves, air pollution effects from stagnant air masses and warmer temperatures that cook the air and you get more ozone and other things that are harmful to people. Infectious diseases. Many insect-borne diseases are sensitive to climate. Waterborne diseases. Remember, it's not just global warming, it's climate change, or really, it should be called the global climate crisis. I've been working on this for a long time, showing that climate change truly is a major public health issue. But people didn't realize how close to our own species climate change really is until they start examining all these ways that climate affects us. You know, we need to do something about climate change. And in 2 months, I'll be in Paris with the United Nations negotiations, where for the first time in history, they are trying to get a binding treaty and country commitments to reducing greenhouse gases. So I've shifted my focus to ask the question, if you were to mitigate greenhouse gases, burn less fossil fuel, what does that mean for public health? Even in our country, between 60 to 80,000 people die every year from particulate air pollution in the United States. So if we were to reduce greenhouse gas emissions to address climate change, and that maybe, for now or 10 years from now or 20 years, reduce climate change so in the future we don't go so warm, immediately, like tomorrow, as soon as you reduce the CO2 in the atmosphere, you have an immediate public health benefit. There's a study that's out there, a good study, that says on average, it might cost us $30 for every ton of CO2 we want to remove from the air to reduce climate change. What is the health benefit value of those avoided deaths and health costs for every ton of CO2 that might cost $30? On average, the health benefit is $200. This is one of my main takeaway messages, that if you do think about the health benefits from a clean energy society, they are enormous as far as lives saved and as far as economic savings. From MIT, a study came out last year that talked about, in America, getting to a clean energy future. What would be the cost versus benefit? The benefit from health, from cleaner air, could be 10 times greater than the value or the cost for that technology. I sincerely believe that a clean energy society, a low-carbon economy, could be the greatest public health opportunity in more than a century. This is where I think that where climate change itself is a major risk, climate change action is a huge opportunity. I think we're at a point in time where we really could turn on a dime. So with that, I am open to questions.
I was wondering, what type of problems are all of the forest fires bringing in particular matter into the climate?
In the climate health assessment, this issue of increased frequency of forest fires is part of the mix, is part of the health hazard, as well as heat waves and stagnant air masses and ozone pollution, the brown photochemical smog. All of those add up as a health risk. What we expect is an increased frequency of extreme heat waves, of extreme droughts, of extreme flooding, and with the disintegration of the Arctic, even extreme freezing in unusual places. But the particulate air pollution from forest fires is a health hazard.
I was wondering if you could talk about ways that public schools could be a part of this initiative.
An immediate thing, very immediate, would be to make sure that public schools are either situated places or enforce safe routes to schools. You know, far too often now, parents are driving their kids to school. That's a carbon footprint right there. So I think safe routes to schools is an absolute priority. There are schools that I know of. Badger School in Madison is completely, it's on renewables. It's got, sustainable food system. It has and locally sourced food. It's got these solar tubes that come into the room. So I think public schools could show innovation for renewables right there in school.
We have had a wonderful evening. Thank you so much, Dr. Patz.